Hello and welcome to this week's meeting of the Rotary E-Club of Silicon Valley. We are a club with that is based out of Rotary, and we are 1.2 million members worldwide with 36,000 clubs. I am excited to join this meeting today and with you and learn about Jared Walker, and Russian's going to do the intro for me.
Thank you so much, Nick. And so we're excited to have Jared with us today. Jared is a character, and I am really jazzed to have connected with him to learn about the things that he's doing as a part of $4. You read the detailed intro coming in, but as a quick summary, 10 years ago and change, he decided that he was going to make the world a better place. And that story of how he does that is one that I hope will be as inspiring to you as it was to me when I talked to him. And with a lot of enthusiasm, I hand the mic over to you, Jared. Thank you for being with us.
Thank you so much for having me. Really appreciate it. I'm going to share my screen here and get going. Yeah, really appreciate all your time. Yeah, I'll dive right in. $4, we're a nonprofit organization. We crush medical bills. And this all kind of came about in 2012. My wife and I were sitting at home. She got a phone call and her aunt had passed away from cancer. A few minutes later, I got a phone call and my cousin had gone into labor 7 weeks premature. Baby needed heart surgery to live. And the family was running around and talking about how are we going to pay for it? And that frustrated me a lot. It was kind of my first run-in with the healthcare system and the realization of when you have a medical crisis, you usually have a financial crisis that follows. And that was something that I wanted to help people avoid if I could. And so I hopped online and came across a few stats. Number one cause of bankruptcy in America, 1 in 3 Americans just avoid care because they can't afford it. And there is a total $195 billion in medical debt in America right now, which is pretty wild. So I wanted to help people, and I started crowdfunding. I started crowdfunding in Portland, Oregon. $1 for Portland was actually what it was called. And it was finding people in our community and getting people to sign up for small, recurring monthly donations. Every month we'd pool the money together and pay medical bills for people in our community. And we started at coffee shops, breweries, music venues, and it was just a very grassroots community effort. And we helped families over the years through our Dollars Add Up program, and it was a lot of fun. And I was at a networking event and I met an attorney, and he asked me, hey, have you ever heard of charity care, financial assistance, 501R? And I had no idea what he was talking about. So he was, saying, hey, there are these programs where the hospitals will actually waive your medical bills if you are within a certain income range. And I had no idea that was a thing, but I felt like a chump because I had been paying medical bills for low-income families that all would have been eligible for free or reduced care if I would have known about these programs. So I switched the model. In 2019, I started finding people that had medical bills. I started digging into these policies, and I launched the debt forgiveness program. So it is true. When the Affordable Care Act passed, it required nonprofit hospitals, which is most in America, to have charity care and financial assistance policies. So this is, if you are within a certain income range, the hospitals have to waive your medical bills, or sometimes it's a sliding scale based off income. So you can get the entire amount waived or pretty heavily reduced. So I started looking into it, and in the first few months, I got over $1 million in medical bills to disappear for people. And I was thinking, well, gosh, this is something. And how do I look this up, more and dig into some more of these policies? And the reality is and this is, is one of those things that is just so frustrating. But yeah, millions and millions of people are on payment plans or declaring bankruptcy that they don't have to pay because they have no idea that these programs exist. And when I found that out, I was shouting from the rooftops trying to tell people, what is charity care? How do you access it? Every single hospital has their own policy, their own application, their own, and it's tough to find, and it's tough to navigate. And then when you do navigate it and you submit it, through fax, which is what most hospitals require you to do, they kind of call all the shots, and there's not really a whole lot of accountability in this space. So I was trying to spread the word, to tell people what this was, and I wasn't super successful, and it was really frustrated. It's like, well, why is nobody talking about this? So my little sister recommended that I get on TikTok. So I hopped on TikTok, and I made a 60-second video that told people what charity care was. So I came across this Stitch, if you're familiar with TikTok, which I was not at the time. So it was a video. It said, what is a piece of information that you learned that feels illegal to know? And I stitched my video onto that. They said, hey, this is what charity care is. This is how you access it. And if you need help, you can shoot me a message. I'll help you out. I'm expecting 50 people to see this video, maybe. The video just blew up. It's been seen over 30, 40 million times. It is, it was a wild few weeks. And actually, what's kind of fun is today is the 2-year anniversary of that video going viral. So that was a crazy time. And at the time, at that moment, $4 was just me. I was running around trying to figure this out. And people were tens of thousands of messages coming in. People asking, can you help me? I've got medical bills at this hospital, and I was just helping people in the Pacific Northwest at the time. So this, overnight, this turns into a national organization, and we have got, I think, in the first, it was over $100 million of medical bills submitted to us, people asking for help, and we needed a way, to quickly see if someone was eligible or not, which we didn't have at the time. So I put out a call to volunteers and said, hey, we need some help. And we got some phenomenal people that created a eligibility screener. So we had volunteers that went through every single hospital in the country, over 8,000 hospitals, researched, read the policies, pulled out the financial assistance info, put it into a web tool. And now a patient can go to our website, put in their household size, their income, what hospital holds the debt, and then we will do the rest. We fill out all the paperwork, we submit the paperwork on their behalf, we advocate on their behalf, we call the hospital, we pester them to make sure that they're doing what they're supposed to. And then we have, phone support, text support, and yeah, so that is what we're doing day to day. We have a team now of about 12. We've got people that are patient advocates full time that are doing this. And if you submit, through the eligibility screener, you'll be connected to a patient advocate if you're eligible, and we'll walk you through the process. So when we launched this eligibility screener, in the first month, it was like $250 million of medical bills submitted through that screener. People saying, hey, I've got a medical bill, can you help me? And obviously not everybody's eligible. We can get into the details of what these policies look like. But since this video, we've been able to eliminate over 20 million, of close to $25 million of medical bills for people all over the country. And that's just the ones we know of, because sometimes we submit the paperwork and we don't hear back from the patient that the medical bills are gone. We've been able to turn every dollar donated into a little over $50 of medical debt relief, which is wonderful. And our plan now is, obviously we're a patient advocate organization. We help patients through this process. We are trying to add clarity into a really difficult process. And the bigger vision here is that we can make charity care known, easy, and fair. So I feel like we're trying to do our best through social media partnerships, SEO and Google ads and all that, to try and get the word out about this program. And then making it easy by creating automations and creating the eligibility screener, keeping our database up to date and then fair, as in we believe that through patient advocacy, we can actually drive policy change at the hospital level, which we've been doing. So because we have so much data, so many patients are coming to us asking for help, we can look and notice trends. So, maybe we have a dozen patients at a particular hospital that are, might not be living up to their policies. We can approach that hospital and say, hey, we've noticed a few things and we'd like to chat. And that's been super effective. And we've gotten hospitals to retrain staff, change policies, have board meetings about this work, and try to make their policies more known to their community as well. So that's kind of what we're doing, what we're trying to do long term. And yeah, it works. We get messages like this every single day, people saying, hey, I saw your video, followed the steps, or you helped me, because we do have a self-advocacy track where if a patient wants to kind of take the info and run, we have all of our instructional videos and kind of encouragement that we can give, and they can fill out the paperwork themselves to try to empower patients to do this. So that is $4. That is what we do, and I would love to answer your questions. I'll put this slide up here. There's a few ways to get involved: volunteer, donate, partner. We are, most of the patients that come through that need help are through social media, and that's great. We've been able to ride the social media wave, and it's been great. But maybe the people that need our help the most, they might not be on TikTok, and we need to figure out how to plug into like-minded organizations that are helping people that are kind of in that similar population, low income. We get a lot of referrals, so other organizations that are serving a similar population that can send patients to us is another way we would love to serve people to get plugged into the right communities. So thank you so much, and yeah, we can go to questions.
Awesome, Jared. Great. We will dive into the questions. First, I want to introduce the people that we've got on the recording. It's a set of members of the club. So joining us from Sacramento is Mike Kane, our secretary. Joining us from Italy, the cool that comes from being able to be introduced as joining from Italy, is Cecilia Babkirk, our treasurer. Our president-elect, Nick Lagarde from Vancouver. Walnut Creek, California, our paella master, Shags Chagrin. All right. I am the programs chair. My name is Rushton. I'm in San Jose, and plenty of questions to dive into. I'll start by saying that our president, Angelica, also in Italy, by the way, is focusing this year on health and wellness. And so we're really excited to get this program. And for those who might be watching the program and thinking, how do I do this? How do I get involved? Jared, maybe we could start with just having you share your screen and show how somebody would get into the eligibility screener.
Yes, absolutely. So let me pull that up real quick.
Okay.
All right. So yeah, I mentioned our eligibility screener. So this is a website. If you go to $4.org/help, it goes directly to our eligibility screener. You can also go to our homepage and get help now. So this is our eligibility screener. This is going to ask you a couple questions. So really what these policies want to know, what the hospitals want to know is, who are you? Who do you live with? How much money do you make? Where do you work? And then prove it. They want to see proof of income documents and all that. But we can tell through the database that whether or not you're eligible by just asking a few quick questions about income, household, and hospital. So, and then you can also toggle between English and Spanish as well. So if you go see if you're eligible, there's going to be a couple questions. So let's say you have, bills at a hospital. You would put in your information here, and it's like I said, it takes 2-3 minutes, and it'll ask you about, what hospital. Let's say, you have hospital bills in let's go Washington. That's where I'm at. And then it'll ask you about, where. Let's say I'm in Vancouver, Washington. And let's say I got bills at Legacy Health, and then I can put in, okay, I've got a $5,000 bill here. And then it'll ask me the age of the bill, and then the household size, the income of the household. And then if I hit continue, it'll tell me whether or not I'm eligible. And then from there, you have two pretty easy options. One is full service. So a patient advocate will be in contact. We'll fill out the paperwork, we'll submit it. And then there's a self-advocacy that I mentioned before, where we'll give you all the tips, tricks, and tools to do it yourself. And then we can answer questions along the way. Both of these options are completely free. We do not charge patients at all. So there you go.
Wonderfully cool. And so in thinking about this as a system, how is it that you're able to do all of this for people for free?
Yeah, great question. We're trying to figure that out. We're a nonprofit. We have been able to survive off philanthropy and the generosity of individuals. We do have a lot of small recurring monthly donors that have stuck around from our early days at $1 for Portland. We have some large donors that give, and then we have, as we've been growing and gaining credibility, we've had a handful of foundations and groups that reach out, say, hey, can we help? I mentioned some accelerators that we've been a part of. So yeah, we're definitely, still a very small organization trying to scale. There's obviously no lack of need. So we can keep going. I feel like we're just getting started, but so far it has been through the generosity of individuals.
And when we look at something like this, I remember you telling the story about $4 to begin with, and I'd like you to share that with the group. So getting recurring monthly payments of $1, how you went about that, I thought was a pretty good story that might inspire some people to think about projects in their own communities. Could you tell that?
Yeah, how we got those individual dollars. So we started in Portland. Portland is a food, beer, coffee kind of town, and weed. those are the things that Portland's known for the most. And I would go into bars and breweries, coffee shops, and I would say, hey, if somebody signs up for a small donation, will you give them a free beer, or will you give them a free coffee, or get into the concert. So I would just go around and talk to these small businesses, and they would let me in and give away free stuff for people that would donate. So we kind of created this community of people through like the food and brewery coffee scene in Portland. That was a lot of fun, early on. So that's how we slowly built our giving community.
That's another level of awesome, is what that is. So we had a great question come in from Mike asking about how we think about, well, first of all, how we think about social media being a tool to make something like this happen. It sounds like social media was the tool that essentially launched $4. Can you talk a little bit about how you've felt about what you've learned about social media over time?
Oh man, social media is just brutal. I'm not the biggest fan. I remember my little sister telling me like, oh, you got to get on TikTok. And I was on like Instagram and Twitter, and I was like, man, I don't want to add another thing that I need to keep up with. So I did it reluctantly, and yeah, it kind of made all the difference. I don't think I'd be here if I wasn't on social media. It's for us, like, we had a young audience, and we continue to have a young audience that follows us, and it's been great. I think that a lot of other nonprofits are trying to figure out, how do you get a social media audience? But I'm also trying to figure out, from the older organizations, like, how do you fundraise well, and how do you, it's like a give and take. I think people look at our social media audience and think, oh, that we got to figure it out or something, but it's a grind. It's it's like if you go big on one of these platforms, and all that does is ensure that you will be spending a lot of time trying to keep up with social media and continue to post content that's valuable and keep up with trends and all that. So it's a lot of work.
So describe a social media post that you would put out on an Instagram or a Twitter or a TikTok, just about, just trying to bring the message of what you're doing down to something very, very short, what would that message look like?
Yeah, so I think that I always focus on like the awareness of charity care. Hey, there are these programs at hospitals, and sometimes what people seem to really like is just picking an individual hospital. Say, no, hey, if you are in Texas, if you're in Houston and you got bills at Memorial Hermann, let me walk you through their financial assistance program, and I will share my screen and go through all the documents and tell them what to look for and whatnot. So there's that's just kind of like the educational basic charity care. Then it can range from, talking about new laws that are added. Recent law in Colorado just went into place about charity care, letting people know, hey, if you're in Colorado, there's a new law and you're able to do these things. And then answering questions that people have. What happens if your bills are in collections? What happens if you're, all these things that come up, all the way to like calling out hospitals. Hey, everybody, been trying to get a hold of this hospital for a while and they haven't been responsive. So can we get their attention? And then you get their attention through social media. So it kind of, it's a range, but I feel like, if every single video was just, hey, let me show you financial assistance policies, I feel like people get bored with that. So you kind of have to mix it up.
Absolutely. So a couple of questions came in about actually about the law related to this. So this came through with the Affordable Care Act, I believe, right?
Yep.
And so are there any ramifications for a hospital of not using funds as directed by the law to reduce or eliminate the medical bills of low-income patients? So if a hospital is making it really, really difficult to figure out how to do this, can they suffer for that in some way?
So I think that, like, in theory, yes, right.
Mm-hmm.
But I think that a hospital has never lost its nonprofit status because they weren't offering charity care. So the whole idea of this, so section 501(r)(4) is all about charity care in the Affordable Care Act. And it is, hospitals they get billions of dollars in tax breaks for being nonprofit. There's tremendous benefits for them being nonprofit. And in order for them to keep that status, they're supposed to be providing community benefit. And community benefit is defined by what one of the main factors is: free care to people that can't afford it. So a hospital might make a policy that says, we will waive 100% of your medical bills if you're at or below 300% of the federal poverty guideline. And then we have a sliding scale discount from 300 to 400%, let's say. And that's pretty much all that is required by law. And they're supposed to be screening people for these programs, but how do you screen? Some hospitals say, well, we put up a poster in the ER. Well, when you're in the ER, you're usually not reading posters on the wall, you're trying to get care. Or, hey, we put it on the back of every single bill. We have a phone number that you can call. So hospitals kind of use that as, oh, well, we're doing all we can. What else could we possibly do? And there's a lot that they could be doing that would be more effective. So there really isn't a whole lot of accountability in this space. Like I said, hospitals aren't they're not being punished for having this. The most that they're being punished for it would be calling it out on, New York Times writes an article that says, hey, so-and-so hospital suing low-income patients instead of offering charity care. That's kind of the extent of what hospitals get if they're not doing it as of right now. So hopefully we can add some accountability in that space.
Well, effectively, you're working to help hospitals do what they're supposed to do and to get good PR as a result of it.
Yeah, exactly. It's it's funny because we go to hospitals all the time and say, hey, you're not doing what you're supposed to do, and we'd love to help you with that. And they're, it's very much like, we are doing all we can. The cases you presented are kind of one-offs, and and then when we give them other ideas of how to make it better for patients, the response is usually, well, word gets out and you don't want to be known as the most generous hospital. So it's a very interesting narrative that we hear from the hospitals. And again, they're able to, like, they can make these things difficult because there is no charity care police. I mean, one really brief example is about 95% of all hospitals in America require you to fax your financial assistance paperwork in. So like, who has a fax machine? You know what I mean? So it's like, that's just one barrier that a lot of these hospitals throw up, say, hey, well, this is how you submit the paperwork. And you can try and tell them, well, that, it's a huge barrier for people. You should have an online portal, or you should do that. And they don't seem to be super interested in that. So we're working on it.
Perhaps they would tell us that's far better than the previous plan, which was to have them record a narrative onto an 8-track and send that in.
Yeah,
so
exactly.
So you mentioned eligibility, that not everyone who does this is eligible, and that there are these basic issues of family size and income and things. What are the kinds of things that typically get in the way of someone being eligible?
Yeah, so typically it is income. So it would be, 300% of the federal poverty guideline. That would be, for a family of, or for like a single, that's right around like $40,000 a year gross annual income. So, and for a family of 4, that might be closer to like 85,000. And so if you make over that amount, then there's kind of 2 options. One, you're just not eligible, or maybe there is a discount. So maybe, if you're only a little bit over, they don't give you free care, but they might give you, 65% off your bill. The other thing is, hospitals throw in a lot of different criteria about insurance. Like, do you have insurance? If you have any type of insurance, then you might not be eligible. In some states, that's illegal. You can't do that. And sometimes they'll give you, other discounts based on having insurance. Like, well, if you have any type of insurance, you can only get X amount. But I mean, we are primarily working with people that are uninsured and underinsured. And when you have insurance, but your deductible is $8,000, and that bill comes in, like, that should be eligible for charity care as well. And we fight those all the time and are successful. It's just it's another one of those barriers that is very much so outside of 501R. Like, it's not in the policy. You shouldn't be able to single out people that have insurance or not. Same with like minimum bill amounts. Some hospitals say, well, if your bill isn't $2,500 or more, then you don't get charity care. Can't do that. But again, they do it all the time. So.
All right. Well, last question for you before we wind things down, and just for the people watching. So, one of the things we do after we finish a recording is we keep talking to these cool people that we meet. You should be joining the recordings. If you're curious about that, contact us through our site, which you can get to at rotary.cool. Really. So the last question is this. You've built this organization pretty much out of heart and enthusiasm. Kudos. And that has attracted people who are like, man, that's a fantastic idea. I'll support that. And in doing that, you've had to bring other people on to be patient advocates. So do you need people? Do you need people who, say, have recently retired and looking for something to do? How does it work that you get people to become patient advocates for $4?
Yeah, great question. So we do have a pretty big volunteer crew at $4, and at the beginning, a lot of them were being trained as patient advocates because we were so overwhelmed. And there is a handful of great volunteer opportunities. One, like if you like kind of the more boring tasks, repetitive stuff, you can help us with our database, because there's a lot of hospitals in there that need to be updated. There's a lot of policies that change and are updated, or hospital buys other hospital, or there's a merger or whatever. So there's a lot to keep up with that database, and it's extremely valuable for us. So that's one thing. And then the patient advocacy work, we have people that primarily that group right now is doing like phone support for us. So a lot of times one of the barriers that people say, hey, I don't have reliable internet, or I don't have a smartphone, can can I call? Can I call someone? And then we can have a patient advocate help them fill out the paperwork over the phone, which is really helpful. So, and then, you know, if there's a lot of people that reach out that just say, hey, I've got this special skill. Yeah, I'm retired. I got some time. And, you know, is that helpful? And we kind of deal with those on like a case by case basis, because sometimes it's incredibly helpful, and other times, you know, it's like, oh, we're not there yet. Can we contact you in a few months? So that is you know, a handful of our volunteer opportunities.
Well, fantastic. We'll wind things down for today, but just a quick note to everyone watching this recording. We're recording this on Martin Luther King Jr. Day. This is a day where in the United States, we celebrate the best of who we can be. And without a doubt, Jared, you know, bringing your heart and enthusiasm to making this work has made a difference in the lives of so many, and very much in the spirit of not just the day, but of Rotary every day of the year, for sure. Those of you who have been watching this, please, if you are watching this on our site, scroll down a little farther. You'll see a place where you can we can get your attendance. We love you letting us know that you are here. And if you do that right, you'll get an email back that you can pass along to your club secretary if you're a Rotarian, so that you can make up a miss if you are doing that kind of thing in your club. Finally, at the bottom of the page, you'll see the discuss section, which is a place for us to be able to share ideas, reactions, thoughts, questions about the programs and the content of our meeting pages. You can post something there, you can respond to other people's posts, and it's one of the ways in an online and asynchronous club we share ideas, and so we hope you will do that. Jared, as we always do, we hand it back to the speaker for the final word. So what would you like to have in people's heads as they step away from this recording?
I would say that everybody listening knows someone, or maybe you are that someone that is going through a medical crisis, and this info can be life-changing. And whether you ever need to use it personally or not, having the knowledge of what these programs are and how to access them can change the lives of people around you, your friends, your family, your community. So check it out.
Service above self. Thank you very much. And everyone, we will see you next week.